Hello, welcome to Pediatric Pulse, and today we are diving into a crucial topic on newborn resuscitation. In this video, we will walk through the essential steps to ensure that every newborn gets the best of start in life, even in the most crucial moments. Whether you are a healthcare professional, a student, or a parent wanting to learn more about newborn resuscitation, this guide is for you. We will cover everything from initial assessments to advanced interventions, all based on the latest guidelines and best practices. So grab your notepad and let's get started on this life-saving journey together. Don't forget to like and subscribe and hit the notification bell so that you never miss an update on the Pediatric Pulse. Let's make a difference, one heartbeat at a time, caring for tiny lives. The first thing you do is doing antenatal counseling to the mother. This is to allay anxiety and to reassure the mother of what is going to happen. Maybe the mother is going to theater for a CS delivery or to the labor ward for an SVD delivery. Another thing is team briefing. During team briefing, give a brief history about the mother and the baby she is carrying to your team. Another thing you do on team briefing is assigning tasks to your team members. And again, ensure that they have done equipment check earlier. Assess if you have ambu bags available of different sizes because the child might be a term baby or even a preterm baby. Ensure that you have an oxygen source, different sizes of mouthpiece for the ambu bag, different airway adjuncts like oropharyngeal airways, and also a BVM that is working, and many others that you might require during the newborn resuscitation. At birth, ensure that you have done delayed cord clamping. If possible, do it at least 30 to 60 seconds or more. Let's delve into the importance of delayed cord clamping. Importance number 1, it increases blood volume. Delayed cord clamping allows more blood to transfer from the placenta to the baby, thus increasing the blood volume of the baby by 30%. Number 2, it increases levels of iron stores. This prevents the baby from getting iron deficiency. Number 3, it increases levels of HB in blood. That is the level of hemoglobin in blood. Number 4, it improves circulation, especially in preterms. It improves transitional circulation with better established blood cell volume, reducing the need for blood transfusion. The point number 5 and the last one, it reduces the risk of certain conditions, for example, necrotizing enterocolitis and intraventricular hemorrhage in preterm infants. As you do your delayed cord clamping, ensure that you have started the clock and noted the time that cord clamping was started and the time the baby was born. 3 key points to note: stimulate the baby, dry the baby thoroughly, and keep the baby warm. After drying the baby thoroughly, remove the wet linen and reposition the head of the baby in neutral position and continue putting the baby under a radiant warmer. Assess the baby for color. Is the baby pink, pale, or even cyanosed? And if cyanosed, is the cyanosis peripheral or central? And for tone, you check for muscle activity and the reflexes. For breathing, use look, listen, and feel. For look, you check for chest rise and the chest movement. And for listening, you listen for abnormal breath sounds like wheezing or even stridor. Then for feeling, you feel for warmth of air coming out of the nose and the mouth of the baby. For heart rate, if the heart rate is below 60, we are already in cardiac arrest. If it is below 100, we are having a bradycardia. Appreciate the neutral position here. Here are the steps to take in order to position the head of the baby in neutral position. The first thing to do is to ensure that the head of the baby is on a headrest and you have a shoulder roll. The first step is to ensure that the glabella and the chin plane are horizontally aligned. And the second step is to ensure that the neck is wide and open. And the third step is to ensure that the external auditory meatus and the suprasternal notch plane are horizontally aligned. If the baby is a preterm and has adequate respiratory drive, consider starting CPAP for the newborn. If the baby is gasping or not breathing, give 5 inflation breaths while connecting the BVM to an oxygen source. Apply a pressure of 30 centimeters of water. If it's a preterm, remember to give a pressure of 25 centimeters of water. Apply PEEP 5 to 6 centimeters of water if necessary or applicable. Apply a pulse oximeter and monitor your SpO2s. At the same time, titrate your oxygen accordingly. Apply an ECG on the chest of the newborn. You can use a 3-lead ECG or even a 5-lead ECG to monitor your heart rate, to monitor for bradycardia, tachycardia, or even cardiac arrest so that you can intervene accordingly. If no increase for heart rate, look for chest movement. Hope you can appreciate in this slide the positioning of the BVM on the newborn. You hope you can see the CE technique here. If the chest is not moving, check your mask, that is the positioning. Remember the CE technique of the mask on the mouth of the baby. The head and the jaw positioning. Make sure that the head is not too extended or too flexed. Hope you can appreciate the first baby on this slide. That is the correct position of the head. This is what we call the neutral position. If you are two, you can use the 2-man ventilation with manual resuscitator or the BVM. One person holds the BVM on the mouth of the baby with both hands with the CE technique and not holding or pressing on the soft tissues, and the other one holds the ambu bag, that is the self-inflating bag, while giving breaths. Consider suctioning, use of laryngeal mask airway or endotracheal tube. These are examples of advanced airways that you can use. Repeat the 5 inflation breaths again and ensure one of you is auscultating for the breath sounds to ensure that the air entry is bilateral. Up to this point, you should have used approximately 1 minute. If no increase in heart rate, look for chest movement. Once the chest is moving, continue with ventilation breaths. Hope you can remember the difference between ventilation breaths and inflation breaths. If the heart rate is not detectable or less than 60 beats per minute after 30 seconds of ventilation, give 3 chest compressions in a ratio of 1 ventilation breath. In this slide, appreciate the 2 techniques used in chest compressions in newborns. Ensure that your BVM is connected to an oxygen source and increase your oxygen to 100%. Up to this point, you can consider intubation if not already done. Reassess your heart rate and chest movement every 30 seconds. If heart rate is not detectable or less than 60 beats per minute, ensure you have a vascular access, either IV or IO, and consider giving drugs. Consider other factors, for example, pneumothorax, hypovolemia, and congenital abnormalities in newborn. Also remember to update the parents and doing another team briefing for your team. Ensure good documentation has been done. Assess the need for help in every step and don't be afraid to ask for help or to consult. In all these steps, ensure that you maintain temperature to prevent hypothermia. Thank you so much for listening and watching. See you in the next video.